our partner organizations can order, and so they get kits that can serve them for their entire month of their period. And then for the diaper program, the families receive 50 diapers per month per child. We distribute those to the partners. We do also partner with several of the library systems.
Hey, everybody, and welcome back to the Grow Healthy, Help People podcast, a podcast that Accordis puts on. We absolutely love talking to our nonprofit leaders. And today we're here with Muriel from the St. Louis Area Diaper Bank. How are you today?
I'm good, thank you.
Good. It's so good to have you here. I'm excited to learn more about everything that you guys are doing over there. But before we get into that, tell me a little bit about how you became to be a nonprofit leader. Did you grow up having just totally different plans throughout high school, college, or was this kind of in your future in your mind?
Yeah, it was not. When I was growing up, I thought I was going to be a performer. Like I said, I can't sing, but I thought, oh, I'm going to be a singer, dancer. And I went to a performing arts high school and studied theater and dance while I was there. So not at all. But in my journey, once I got to college, what I really thought I was most interested in was communication, all forms of communication, and doing public relations and really helping, organizations tell their stories and those types of things. And so I got my bachelor's in communication so that I could help do that, and just fell into fundraising and development at different nonprofit organizations. And along the way, sort of thought, I would like to, lead a nonprofit organization. I thought that would be something that I might be good at, and I learned a lot of different skills and had a lot of experiences, and I was on some leadership teams along the way. So somewhere, mid-career, I was like, I think I could do that, and
Yeah.
just started kind of just amassing different skills and experiences so that I could be able to one day do that. And so here I am.
Yeah, that's incredible. I love that you have that's a big difference going from performing arts to working in the nonprofit space. Do you still, I'm just curious on the side note, do you still um get excited about the performing arts, like get them, like to go see it, like to watch it, anything like that?
Oh yeah, I still
Yeah.
love doing that, going to the theater, to see
Yes.
co-productions and seeing dance. My daughter and I last year during Christmas time went to see the Nutcracker, which is my favorite
Oh
also
yeah.
like Christmas thing. And so I was excited to go do that. And yeah,
Yeah.
I still love the performing arts and really,
Yeah.
really all kind of like artistic
Oh
types of
yeah.
professions. Mhm.
Yeah. Awesome. So cool. Okay, so a little bit about the St. Louis Area Diaper Bank. So tell me, what all do you guys do over there?
Yeah, well, we have two basic programs that we do for the families and individuals in St. Louis, the St. Louis region. Our biggest program is our diaper distribution program. We partner with about 70 plus different organizations across the St. Louis region to distribute diapers to the families that they serve. Those families are receiving other types of services or resources. It's healthcare, childcare, other social services, education, all those types of things that the organizations that we partner with are providing. And then diapers are an identified need that the families have. So they partner with us and we provide the diapers to them. And then our second program is our period supply program, which we started during COVID. So in 2020, we started this program to do the same thing. So to distribute period supplies to individuals that were in need of those items. Same concept, we partner with other organizations, we provide those items to them, and they give them to the individuals that they serve. We For the period items, we actually have kits. So we put 25 items in a kit. We have a variety of different kits, mixed, kits with different types of items in them that our partner organizations can order, and so they get kits that can serve them for their entire month of their period. And then for the diaper program, the families receive 50 diapers per month per child. And so we distribute those, to the partners. We do also partner with several of the library systems here in the St. Louis region, and those work a little bit differently than our regular partner organizations because they're technically not really receiving services and aren't really, a client of the library, but it's a way to expand access to these items to families and individuals that are not receiving services or resources from our other partner organizations. So you don't have to be a member or have a library card or anything like that. You can just go to whatever library
Mhm.
closest to you and get diapers or a period kit. And they can go back every month, just like our partners are distributing every month. And then sort of our branch, sort of third program initiative is our potty training. And we have potty training kits that have all the things you need to train your child for potty training, and we provide those to to our partner organizations, and they provide them to families that request those that have children that are ready to be potty trained. We also have a potty training program with the one of the library systems, St. Louis County Library, where people can sign up and go to the they call it a story time. So it's but they listen to a story and then they tell them what's talk about potty training, and they go through the kit and can get kits that way. So those are just sort of our three main things that we're doing at the St. Louis Area Diaper Bank.
Yeah, I love that. It's those items, diapers and period supplies. Those are very expensive items, and so I'm sure like the need is so great. And I know that from running a nonprofit myself, I would experience teenagers, especially teenage girls who wouldn't be able to go to school during that time of the month because they didn't have the supplies they needed. And so I learned then, like, it is such a great need for someone to provide those resources. And I love how accessible you make it to them. I think it's wonderful. It's such a great program that you're doing. Do you see a lot of the organizations that you work with are they working with students also, or do you know if they're in the schools, especially for those period supplies, of course? Are they working with students to help schools get those to them?
Yeah, they are. We work with a few different early childhood centers, specifically on the diaper side, obviously. But then we have other partner organizations that work within the school districts here, and they provide those period kits to the students in those schools. In Missouri, actually, about 3 years ago, designated funds for all public schools to be able to purchase period supplies for students. um, yeah, so a lot of the schools, and there are a lot across school districts across the state of Missouri, but they can utilize those funds that are designated from the Department of Elementary and Secondary Education to purchase period supplies and adjacent things. Like there's some, period underwear. I think some of that accounts for like pain medication, that kind of stuff, um, for their students. So we're lucky in that respect that schools have access to that funding.
Yeah, that's really awesome. That's neat. A lot of places need to do that because that's incredible. Um, so tell me a little bit about, you've been in the nonprofit space now for years and you've worked with different nonprofits. So what are you seeing right now in the space that you're in as some of your main challenges that you're facing as a nonprofit?
Yeah, for us, I think because of um, the environment, the economy, um, and really just continuing to see the effects of that COVID had on people's lives, particularly people that were already struggling to afford things that they haven't necessarily rebounded like, some of us have and were able to. And so the need, for us to even exist, for families to need diapers because costs are so high, or period supplies because those are costs are so high, that we're seeing, our partner organizations wanting to provide more or needing to provide more, those resources because they have families that, more families that are needing those items. And so I think it's just trying to keep up with the increased need and trying to
Mhm.
ensure that, people that need these items have access to them and that we can be able to provide them. And then for, nonprofit organizations, like we are an organization that raises funds to be able to, live out our mission. And so,
Yes.
with that being said, we aren't federally funded, so we don't have that particular issue that a lot of organizations do. But a lot of our partner organizations are federally funded and have seen their funding either cut or severely decreased, so that impairs their ability to do their programming and
Yeah.
do that. And then for us it's more people, more organizations out there that are looking for grants of foundations and corporations of maybe that we are also applying.
Yes.
And so that means the funds that we would normally get are either, it's a smaller pool of funding for us, or we just don't get that funding. And so
Right.
it's a constant struggle of, trying to figure out where we're going to get the money, how are we going to bring the money in, and and grow our revenue. When we know that there's so much more competition now for funds, and that us trying to get federal funding, probably is not going to work, since the federal government's kind of cutting back on their funding for social service, programs and things like that. So
Yeah.
I think for us, that's like the two biggest. Like the need continues to grow. We're trying to keep up with it. We're a small organization,
Yeah.
and trying to figure out where we're gonna, continue to get revenue from so that we can grow to meet the need.
Yeah, absolutely. So you try to get grants, and I know those are really important, but like you said, there's a lot of other organizations battling for that same grant that you're going after. So as far as like resources and where you get diapers and period products, outside of purchasing those for yourself, are there companies that you partner with? Do people, just individuals and businesses, sponsor those items or purchase those items for you? How do you get the product?
Yeah, so the majority of the product that we distribute, we do purchase wholesale. We get it at a pretty, inexpensive cost to us. And we have a really good distributor that we work with to get those items. We also have a couple of other national organizations that we partner with. So one is the National Diaper Bank Network. of which there are 300 diaper banks and supply banks across the country that are members of that organization. They have a relationship with Huggies. Um, and they, about twice a year, I think, they donate to different diaper banks. And so we do get in-kind donations from there. We also, this is our second year being a partner of an organization called Baby to Baby. They're out of California, and they don't just do diapers; they do all kinds of items for babies. But we partner with them on diapers, and so they do donate diapers to us quarterly, which is very helpful.
Yes, absolutely.
Yeah, so we do have those two avenues for getting like the larger in-kind donations, so that helps us kind of offset cost of the purchasing that we do. And then, of course, the community. So people do in-kind donation drives, churches, schools, individuals, companies will do donation drives and donate, diapers and period supplies to us.
Okay. Yeah, that's wonderful. I love that. So, talking about the struggles that nonprofits face, if you're a nonprofit leader and you're watching this, there are so many areas in running a nonprofit that can be extremely difficult and challenging, especially when you're wanting to just spend time focusing on the mission. You don't want to be so consumed and worried about all the things going on in the background. And that is something that Acordis can truly step in and help with. We handle all the back end things so that you don't have to. So if you need help with marketing, social media, your website, your accounting, we step in and take care of that for you, take it off your plate so that you can focus on your mission and doing what you've been called to do. And so that's what we like to be able to step in and do. And if you need someone to do that for you, our link will be at the end of this podcast and you can reach out to us if you are interested or have any questions. So, talking a little bit more about the diaper bank, now that you've been with it, how long have you been with the diaper bank?
Almost 6 years.
Okay, so you've been there a while. What do you see as far as growth for the diaper bank and where they're going over the next, 5, 10 years? What does growth look like?
Yeah, that's a good question. We actually have the strategic plan that we have right now is a growth plan. So it's looking at it's a 3-year plan, and we're in year 2 right now. But it's really looking at how can we grow to distribute 5 million diapers and 1.5 million or more period supplies. And so currently we distribute about 3.5 million diapers and a little over 900,000 period supplies. So we're really looking at what structure we can put into place, what do we need to do internally to be able to facilitate, that expansion and our distribution. What does our warehouse need to look like? Our volunteer base, all the packing of the diapers and the period kits, that all gets done by volunteers. So what does that look like as far as the volunteer workforce that we have? Um, what does that look? What will our warehouse look like? How will we be able to put that many, that product in the warehouse? Um, Staffing, we have 8 staff members right now. 2 of those are part-time. What other staff do we need to be able to support that growth um, that we're looking at? And our board. What does our what do we need on the board to be able to support staff? In that growth, and then fundraising. How can we continue to grow our fundraising? Our revenue. We do have a couple of sources of revenue that are not fundraised. And so, how can we grow those sources in addition to the fundraised revenue? So it's just kind of looking at all those things once you say you're going to grow, you have to figure out like the supports that you need um, to be able to facilitate that growth, but then also be able to sustain it once you get to that point.
Yeah, yeah, absolutely. And, I think that's really good information for people to know because a lot of times when the general public thinks about a nonprofit, they truly cannot understand until they've been in the space how much work has to go into growth at all. Like, it's one thing to just say we want to serve more people, but it's a whole other thing to actually be able to accomplish that. And there are so many steps and things that have to go into doing that. And so, what are some ways that people can help you guys get to where you want to be? How can people serve you? How can people donate? What areas are people able to help you?
Yeah, there's several different areas. One is volunteer in our warehouse. So we have different volunteer shifts for individuals that people can sign up on our website at their convenience. So definitely do that because that we depend on volunteers to sort of they're our labor force. And then we take schools and groups and corporate and all that kind of thing to help us with that. Um, the other thing is always, donations, both in-kind donations and monetary donations. With the monetary donations, which we kind of talk about a little bit more because we pay for diapers. It's about 16 cents per diaper. So we can buy a truckload of diapers for $50,000, and that gives us about 200 to 250,000 diapers. Just that $50,000. And so that's always a great way to go. And so people can do, peer-to-peer fundraising or fundraising drives and donate those funds to us so that we can purchase the diapers. And then donating diapers and period supplies is always helpful because we can purchase so much, but it's always nice to not have to purchase things have those items that
Have it in stock. Yep.
yeah that are donated. And I think the other thing people don't think about is just learning and then talking about diaper need and period poverty, um, just so that people understand what it is, how it affects people's lives. And we do some advocacy at the state and federal level. We were successful last year in getting a bill passed that exempts diapers and period supplies and incontinence supplies from tax, sales tax. So we were, successful in that. And so I think, having more people just talk about, how those two things affect people's lives and, anything that we can do to, make people's lives better and, having wider access to these items, be they, for the period supplies and restrooms, wherever, at work or school or, out in the community and being able to have families have wider access to diapers, in other spaces that maybe they could get it through Medicaid or through, their insurance company. So, try to do things that complement what we're doing here, which is we're distributing these items for people that need them and partnering with other organizations, but they're not getting all of their needs met here with the amount of diapers and period supplies we're giving them. So if we make it easier to purchase, less expensive to purchase,
Mhm.
or broader access, to these items that are, free in other areas, that certainly is going to help people and
Yeah.
improve their lives much more.
Yeah. Absolutely. Well, that's wonderful. And guys, if you want to get involved, if you're in the St. Louis area, or even if you're not and you want to get involved financially, we're going to have a link to their website at the end of this episode. So please go check them out, see how you can get involved, see how you can help. What they're doing is absolutely incredible and so needed in their area and really in a lot of areas. And so I encourage you to go and see what all they are doing and how you can help. Muriel, it has been so wonderful talking to you today. Thank you so much for joining us and just sharing all about your guys' mission and vision and what you're doing.
Yeah, thank you. Thanks so much. I enjoyed being here.
Absolutely. All right, guys, we will see you next time. Bye bye.